Good evening, everyone. We're going to go ahead and get started. Wanted to give everyone that may be stuck in traffic a little time to get here. But we're also recording this on Metro Nashville Network, so we'll be able to show this to anyone that wasn't able to arrive and be with us in person this evening. Thank you for coming out. My name's Lionel Matthews. I'm the Director of the Mayor's Office of Neighborhoods and Community Engagement. And on behalf of Mayor Berry, definitely want to welcome you out to this meeting on an update of the Criminal Justice Center, the new Criminal Justice Center design and plans. And so the purpose of tonight's meeting, we want to be able to present the designs. Of course, we met with the community back in the spring. The community was able to provide feedback to the architects. The mayor was able to provide feedback to the architects, and the Sheriff's Department provided what their operational needs were and what they needed the facility to be able to allow them to do. And the architects came back with these designs, and we want to present them to the community. We want to see if we got it right, if we heard the community right. And before we get too far into demo, before we move into the next phase of construction, breaking ground and construction, we want to make sure that we do indeed get it right, because this facility will serve our community for many years to come. So we're going to have Nancy Whitmore come up, and she's going to introduce the architects, and then we'll take a little Q&A, and we'll have the Sheriff's Department present some of their operational needs that went into some of the facility design and talk about future operations once the facility is done. So, Nancy?
Thank you, Lionel, and thanks to each of you for being here tonight. We were here back in the spring, and a lot's happened since then. So we're very pleased at where we are with this project, and we can talk about that if anyone's interested in the demolition and what's happening, but we anticipate construction in sometime in January. So this meeting tonight is very important to get feedback from the community. With us tonight is Jeff Goodell. He is the Director of Justice for HOK, who is the architectural firm that is doing the design work for this facility. This firm has an extensive background and experience in designing public, jails, prisons, detention centers, these types of centers across the nation and internationally too. So we're very fortunate to have them on our team. Also with us tonight is Keith Pyle, who is president of Bell Construction, and Kevin Keller is the, I guess, superintendent or principal in charge. Okay, so Kevin, we see a lot of him every day in working on this project. But again, thanks for being here. I'm going to turn it over to Jeff. He's going to walk through these renderings, and then we'll take questions and answers.
Is the microphone mobile, or do I need to speak into the mic as I present? Stay here? All right, I'll stay here. So, as Nancy said, I'm going to focus on the exterior of the facility in this part of the presentation, and then where the facility interacts with the community, and then the Sheriff's Department's going to talk more about some of the policy things and other programs that are being implemented in the facility. If we look at the perspective on the far right, that's the look of our building from the front. That represents the front door with a plaza out front. I'll talk a little bit more about the plaza in detail as we go. But we talked about a facility that was open to the community, more friendly to the community, I think certainly than the facility that's there. But also importantly, it is coupled with historic and really revered civic courthouses and other facilities right in the heart of your city. So it was important to have a facility that again, was open to the public, but also respected and fit in well with those facilities. So, you know, the front lobby that we're showing is glazed. It lets a lot of daylight in, and we feel, again, friendly to the public. People that come to the detention center come for a variety of reasons. Families that are under a great deal of stress because there's somebody there, family members to come and bail people out, attorneys, victims, other folks that come to the detention center for a great number of reasons. We think it's important that it's a facility that is open and friendly and that people can feel comfortable in, and it really lowers that stress level. One of our recent facilities that we've done that's a similar one to this has been open for 6 months, and on the inside, it's been reported to me there have been only 2 fights among inmates. So in fact, these environments actually do make a difference. The second rendering you see is the facility at night. And we think, and again, these detention centers are 24/7 facilities, so people are coming and going all the time. So it's important that, again, as they approach the facility, that it's well lit and that it is, and it feels comfortable, and again, low stress and not intimidating. And the materials, I should mention too, are also based on, again, with the courthouses, the quality materials that fit well into that setting. The third rendering is the facility on the other side, I guess we'll call it the back side, that's on Gay Street. And what you see in that rendering are two things. So there's the upper part is the housing tower. That's where the inmate housing takes place. The lower part, where the cars and pedestrians are, that's a mental health wing of the facility, which is a really innovative program that the county and the sheriff's department are implementing in order to divert people, again, towards mental health treatment and away from jail. We'll get a little bit more into the detail as we go. The following rendering is a close-up of that area. Again, it's a public entry, and it's an entry where families, where volunteers, where mental health professionals and sheriff's department and other county employees will be coming and going. And again, really with the introduction of green, sustainable space, the introduction of daylight, we think is very important. The next rendering to that is the inside of the lobby, as you would see from the inside of the public lobby. Again, we're bringing the daylight in, but we're also using materials that are more natural and having ample light and space in that area. If you've been to the current lobby, you know that there isn't a great deal of space. But this not only is space to, again, reduce stress, be more welcoming, but it also gives the sheriff's department the ability to have folks zoned within that area in a way that's effective. People that are under stress can be in one place, people that are with families can be in another place, and they're going to be waiting directly adjacent to where the visitation facilities are. The rendering that I have here, right here to my immediate right, is from the inside of the mental health facility. Again, 60 beds in here, voluntary, with the ability to bring in light high and low, and in really think in more of a healthcare type of environment for folks, which is important for the healing process and evaluating folks. And again, the use of color, the use of light, ways that help staff and helps the people that are using this facility. Equally important to what happens with the building itself and inside the building is how the building sets within the community. And we've really tied in with the plazas that are at the city hall and at the courthouse. And the plaza that we're depicting here, this view from up above shows fountains, shows trees, shows a raised area where people can sit, talk, visit. And it isn't just about being the front of the jail, but it's really part of that entire government complex. So the mayor's office, the sheriff's department, the county, city are making an investment to really make this a civic plaza and make this a place that's more welcoming and part of that, and not just a set-aside detention center. And the last rendering over to the left is just a close-up of that shows the fountains, but shows the areas where in front of the building the people can sit, talk. And I think especially for people that are coming to visit somebody at the jail, to have an area to decompress and be outside and be part of that, really important, and again, tied to those other plazas. So with that, I'd be happy to take any questions related to those items.
Jeff, because some of the questions may get into operations, let's go ahead and have the sheriff's department
Certainly.
present, and then we'll take questions all together.
Great. Okay.
From the sheriff's office standpoint, from the sheriff's office standpoint, this facility replaces a facility that's very dated, and it kind of brings us into a new millennium, so to speak. The operation of the facility is what we're doing in our current facilities. The big change for us is going to be the mental health center. It's a diversionary program that the sheriff's vision is to make sure that people that have a mental health problem don't get locked into a jail. They actually need the treatment to get better. And I think when they come in the front door or the back door, what's going to happen is somebody's going to be there to evaluate this individual. Are they a mental health in a situation, or are they somebody that needs to be in a jail facility? And it's going to depend on their criteria, what their crime was, how mentally ill they are, and there'll be mental health people there to evaluate and make sure they go to the right door. If they go into the jail, they'll go into our process. If they go into the mental health facility, they'll go into a facility that is not a lockdown facility. It's basically voluntary on their part to go by the program and to be released back in the community to be received by somebody that can help them with their needs. This stay may be 4 days and maybe 20 days, depending on their status. But that'll be staffed by mental health professionals and individuals trained to handle those individuals. Not necessarily DCSO deputies. There'll be people that are trained that'll handle that type of population. Any questions?
At this time, we'll open it up for questions. I do want to recognize Councilmember Berkeley Allen, Councilmember Brett Withers, and also Councilmember Bob Mendez, who are with us. And before we open up for question, I got the question before we came here tonight about the sheriff's headquarters. So just to make it clear, the sheriff's headquarters is not a part of the design for this facility. That will be at a separate location. General Service has presented the sheriff with several available metro properties in the county, and the sheriff will choose what he thinks is the best location and present that back to the Metro Council to approve where that facility will go at a later date. But that is not a part of this project, and just wanted to clarify that. Ms. Chambers, would you like to start the question off?
Thank you. I think I might be the only constituent in the audience. It's really good that you guys held this meeting, but I think a lot of people might not have been able to come at this location. But I have several questions about confirming the operation. So the old jail held approximately 700, 800 people. Is that correct? And will this new design do that? Will it have that many, same capacity? And then is there still going to be, like the Briley Bridge, is there still going to be safe access to get to court from?
Yeah, if you, I know the sky view in the first rendering, if you look all the way to the right, I don't have a pointer, but you can actually see it's still there. But can someone address the question? So for the purpose of Metro Nashville Network, let me repeat your question. She was asking, does this facility have the same number of beds as the current facility? And also, will the skywalk remain a part of the design in the new facility? Here, if you could, please.
The new facility will take the place of the current CJC and the Hill Detention Center down the street. That combination is about 1,300 beds. This will have less than that, but it's to replace both of those facilities. And as far as the walkway will remain as it is and be connected to the new facility for transport to the courthouse.
So how many beds will be there at this new facility?
Around 1,000 beds.
Okay. And as far as the mental health, there's 60 beds?
64, correct.
64. Who came up with that number? How did that number get calculated? Isn't there more, well, the old jail, didn't that have more beds for health issues?
So Ms. Chamber asked who came up with the number of beds in the mental health facility, and how was that number calculated?
This has been a vision of the sheriff for a long time, as far as diverting these individuals. What we did was took the number of people that have come into the facility over the last numerous years, what their ability to go to that facility would be. I actually crunched the numbers to figure out the best number, and the number 64 is what we feel is adequate for the population we serve. Because not everybody that comes in can go to that facility, depending on their charges.
Sorry, is that a reduction in the number of beds that were at the old CJC? Weren't there more beds for either hospital? Maybe it wasn't mental health, but it had to do with health issues. Weren't there
Well,
four?
the beds at CJC weren't designed for that population. This is a whole new initiative. Those individuals that go here would have gone into the jail where they really need to be in a facility like this.
Yeah, I think we need to.
Yeah, but I think, but there are still treatment beds inside the jail. There are still beds to address inmates that have medical, certainly acute medical, but also mental health treatment. So there's a number of beds earmarked for that. So in fact, we're improving and increasing the medical facility in here by a great deal. So in addition to that, we'll also have more negative air pressure rooms and those types of things to deal with the medical, but we also do have a number of beds that will be specifically for mental health treatment too, in addition to this program.
I don't want to take up all, I have a few more questions, but if somebody else has any questions, I'll be happy to let them speak.
Well, I have a few. I'm the Reverend Joe Engel, and I've spent my adult life as a United Church of Christ minister visiting prisons and jails across the South. So, a couple of things about this I was concerned about and I raised in a prior meeting. I don't think I have an answer in what I'm looking at in terms of the drawings and what you put forward. So number one, a national consensus has emerged in the last 3 years from the Koch brothers to the ACLU and everybody in between. And that national consensus is we need to drop our prison and jail population by 50%. 50%. If we're talking about 1,300 people, including the Hill Center, and we're only going down to 1,000, that's not 50%. So I'm really curious about how we came up with 1,000 in light of this national consensus that we need to be dropping that population considerably more than 1,000. The second concern is this. As I raised it in the earlier meeting, again, I don't think it's been met. As Lonnell knows, we have a restorative justice effort going on in this city in juvenile and then going into adult court that's going to impact the number of people coming into this system. We're diverting them. I don't see any recognition of that in terms of designing the number of beds in this facility. And that's really troubling because the history in prisons is if you build a bed, you're going to fill it. So how did we come up with this 1,000 number, and where does that come from? And then I also have some questions about the mental health numbers because as I understand it, in the prior meeting I was told 1/3 of the people in the jail there with mental illness in one form or another. Now, I'm working with NOAA and we're also working on diverting people out of the system who are mentally ill. Again, I don't think there's anybody here who's talked to NOAA and the efforts we're working with juvenile court and adult court and trying to divert these people out. And I did spend an hour with the sheriff talking about these matters and I'm grateful for his time. But given what we have going on as community alternatives, why are we building such a big jail?
So Mr. Engel's question referenced national data or national recommendations to reduce the prison population by 50%, and also with restorative justice and other diversion efforts going on. How was the 1,000-bed number accumulated given what's been recommended nationally? Is that a fair summary? And given what's going on with community diversion efforts also, so.
You know, the sheriff's very passionate about putting us out of a job. I'm fine with that. The initiative has started, and we're building the beds that we feel we need or is recommended by our population projection unit that gives us the numbers, and we don't arrest the people, the police do. We just receive them from the police. We have to have a place to adequately house them and treat them while they're in our custody. So I understand your question, I understand the initiative, but there's other factors that go into that that are going to get us there in the long run. But in the short term, this was decided as the number of beds we need to adequately serve Nashville at this time and now into the future.
But I guess, did you crunch any numbers? I want some data. I don't want an opinion. How did you arrive at 1,000? What is the study that you used to justify coming up with 1,000 for a number?
The population projection unit that is part of Nashville government, they are the ones that crunch the numbers. They're the ones that decide where we were and where we're going, the national trends, the population of Nashville growing, and they determine what the population will look like into the future. And that's how we derive those numbers.
So their population was the general population of Nashville or the population of the jail?
Nashville.
Well, that doesn't really speak to the jail population, not at all, because
Well, it
we're
does
talking
because-
about diversionary programs we're bringing online. Doesn't matter how big Nashville is, if you've got diversionary programs in place diverting people out of the criminal justice system. So I would urge you to take a look at these programs and figure out the impact they're going to have on the population, because it could very well be you build 1,000 beds and hope to God we don't fill them because of these programs, but then we've got a big waste of taxpayer dollars. So I would really encourage you, with all due respect, the general population of Metro Nashville doesn't have anything to do, except in terms of a general number of people who are coming into the town, with how you respond to crime. That's a whole different issue. So I would really encourage you to look at that, commission a study, do something before we get wedded to this very expensive project, which may be overbuilding what we really need.
I'll just speak to, and the mayor's office works with NOAA. We meet with NOAA on a quarterly basis. If NOAA's the one that's studying this, then we'll be willing to work with them to gather the information about what community programs are out there and present that to the Sheriff's Department to see if that would change their calculations, Annie. Mr. Garrison?
Yeah, what is the budget right now for this project? I know 113 million was originally approved, and another 20 million this past year. So, but what is the budget that the city is working within to finish this project here?
I mean, we have to work within that budget. We don't have cost analysis back yet for the design that's been presented. So as soon as we have that back, we could.
Are those figures still the ones we're?
Those are the figures that we're working toward. That
20 million was for moving.
Correct.
Okay, so it's the 150. And then the other thing, are we still referring to this as the Criminal Justice Center, or is it downtown jail? What are we?
So Criminal Justice
Not the
Center.
police headquarters, or what's the name here?
It's the Criminal Justice Center. We're about justice for even those that may commit crimes and making sure that fairness is upheld. So
Everybody in the jail is innocent until proven guilty, so you can't say they committed crimes they haven't been tried yet. They're just there because they're poor, so that's an important distinction to make.
point well made. Thank you. Council Lady Allen?
I'd just like to ask a question about flexibility, which I think ties into that. I mean, it's, as one who votes for how Metro spends our money, I want to be sure and feel comfortable that we're spending it well, both for now and for in the future. And it's a little frustrating to tear down a building that we built at one point thinking that was going to take us into the future. Is there better sort of projections of I mean, there's no way to tell the future of what facilities will need to look like 30 years from now, but I hope that we don't say it's a dated building in 30 or 40 years and have to start over again. Can you address flexibility or ways to adjust that can make work better than the previous building did?
Councilmember Allen asked if this facility is being designed and built with the thought that this facility would last and stand the test of time for the city's needs.
So one thing I'd point out is that these beds are not only to replace the beds that are being demolished, but they're also part of a system where you actually have other facilities. And the concept here is that these are the more modern beds, the more treatment happens here. As hopefully an overall jail population reduces, more and more of the inmates or people that need to use the detention center, criminal justice center, will be diverted to this facility. And in fact, the other older facilities will be retired over time. So this will become the central CJC. In terms of flexibility, it's an excellent question. The Sheriff's Department has made a commitment to a direct supervision method of managing inmates, which really places the officers face-to-face, interacting with them more. And studies over time have proven that has better outcomes in as far as managing inmates, importantly, but also importantly on outcomes of when inmates actually come back to the community. We have a number of units that are designed in order to use that direct supervision method, but also designed to be able to handle minimum security, medium security, maximum security inmates, as well as ones with special needs, women especially, an important population. So these units are designed to be able to take on those different populations. So what we hope won't happen is that as things change over time, as they do, the way that supervision happens, those types of things, that these units won't be obsolete. In fact, they're made to be more flexible, more open, and again, to be able to move folks from the older jail as hopefully as it reduces, perhaps someday down the road, this might be the only CJC you have here in the county.
This is probably more of an operational question than an architectural question, but as our society is looking more and more at gender issues and how folks with different gender identities or expression, in the criminal justice system or even the healthcare system in some cases, has any thought been given as to how to treat some of those different populations?
Councilman Withers asked that as society looks at gender issues and how citizens identify themselves, has thought been given to operationally how those individuals are treated?
Mr. Wilkes, as the Chief of Corrections, will have him answer that for you.
Wow. Hey, good evening. Tony Wilkes, Chief of Corrections for the Sheriff's Office. To answer your question, currently we are nationally recognized for being compliant with what we call the Prison Rape Elimination Act. And as a part of that, we are required to create an environment that recognizes certain gender identities, whether it be transgender, intersex, what have you. When Mr. Goodell was talking about the physical layout of this institution, it was, I think it's specifically designed to manage different types of population, whether it be males, whether it be females, and across all genders. And if we had the need to house a certain population in a certain area, each housing unit is set up that we can do that and be flexible in that process. Okay.
Ms. Chambers?
I'm sorry, I had three main areas to follow up on. One is how much money has been spent thus far on this design? I heard over the summer there was about 11 million spent on design, and then there's some cost for removing asbestos. So I'm just wondering how much of that cost was anticipated to cost. And then I had procedural questions about how is the booking going to work and the release. Is that going to happen here or somewhere else? If you could run through that. And I'm wanting to make sure whether people can receive their court papers. I don't know if I'm using the right term, but if you're in diversion and you have to get some kind of a paper from the judge or the judicial system, there's a process for that. If you could walk through that, how is that going to be any different here? And then to this gentleman's question about the number of beds, how does the CCA contract, Metros has a contract with CCA, and there's a prison of about, 1,500 near Harding, and there's the Harding Detention Center, and now there's this. So it's like a 3,000 bed facility, is that right? And so maybe could you address the total population? Maybe is CCA gonna shut down in a couple years and this will replace it? Maybe that might help explain his question.
Could you repeat the second question for me really quick?
Second question.
Yes.
The bookings and how is it going to work? The releases and bookings and court orders.
Okay, thank you. The first question, Nancy, do you want to address where we are currently with what's been spent on the project?
Councilman Mendez, he put forth through a council a reporting system, and we've been working with council on how we report not only on this project but for all capital projects. So we are working with the finance department, and we will be issuing those on the website so that everyone can see where we are on expenditures. So those are one of the things, Margot, that we can get out to you. And I know that's been a question of yours for some time, exactly where we are. And it depends on, whose numbers you're looking at. So that's why we wanted to have everything reported in the same manner, and it's consistent, and all the projects are being reported in the same way. So as soon as we get those, Councilman, I don't know if you want to respond to your request and what you're expecting from us, but I know we've been working very hard in making that happen.
I can do that if you want.
Sorry.
You want to come up for the
Put you on the
first
spot.
Metro National Network and making sure that it's recorded.
Thanks. Basically what Nancy just said, the idea is just to have a standardized way to tell on a ongoing basis once projects are approved, especially really large ones that are going to take a while to build. It's all the data is there in the 1,000-page of budget materials, but it's hard for the public to find out exactly what's been spent and where we're at in the process. And I know that Metro Finance has been working hard over the last couple months since we agreed on that to get that in a standardized format. And I don't think it's quite up and going yet, but I'm expecting it soon. And it'll hopefully help us all be able to answer questions like that going forward. Thanks.
Thank you.
Thank you, Councilman. Ms. Chambers' second question was operational, and does this facility change the booking process? How is that going to occur? And also, how can individuals access documents for court purposes that they may get from judges or through the judicial system and release?
Okay, I'll take the first part of that question. In terms of the booking and releasing, in this facility, there will be a centralized booking and releasing facility that will encompass everything that's in your downtown area. In terms of our other facility that's on Harding Place campus, which may end up after this is built only two. It's the male facility and as well as what was the female facility before we sent them over. Those releases will still occur as it always has. But in this particular facility, I have to say, in looking at some of the preliminary drawings, it is well done. Everybody will come through one centralized area, and then there's a separate exit on the backside that would allow all the releases to go out. And we wanted to make certain that it was still in the same proximity with some of the bus routes and all of those things. So that still will occur in this institution.
Let me ask the CCA.
Court papers.
Go ahead.
In reference to court papers is the responsibility of the county clerk's office, of the court clerk's office, and they're in the Birch building. So they will have a very minimal presence in this building. That'll be done across the street. Okay.
And Ms. Chambers' last question was about the total population between CCA and the Criminal Justice Center, and how is that total population accounted for in the prison reduction projections that you all have made?
Well, the CCA facility is a standalone facility. It's a prison. It's contracted by the state to house locally sentenced felons. So it's completely separate from the sheriff's office. So I'm not sure what the question.
The sheriff signed a contract with CCA in 2015 for $100 million for 5 years. And so I'm just trying to, it was approximately 1,000 beds. And that's approximately, I don't remember the total bed count at CCA, but a lot of people don't understand that CCA houses people that currently should be at the Metro jail, right? Jail, not prison, correct?
John Hudson's our chief of administration.
Okay.
John Hudson, Chief of Administration. The question is, Metro Davidson County has entered into a contract with the state to house locally sentenced felons. And in Davidson County, locally sentenced felons are 1 to 6 years. So they have to be convicted of a felony for that to happen. And so we did enter into a contract to have CCA run that facility. And so what's the second part of your question?
There's about 1,000 beds there. How many beds are at that facility?
1,400.
About 1,400.
1,400, and then And then there's another 1,000 at the Harding Detention Center.
There are 3 different facilities at Harding Place.
So about
That are
how many
jails.
beds at all the facilities?
Right about 1,000.
Okay, and then there's another 1,000 here, so 3,500 beds approximately is what we're looking at in this county.
Yes.
And is, with CCA announcing, or the Department of Justice announcing they're exiting the private prison business, is there any consideration about that facility either going away or somehow reduced? Would that address this gentleman's concern about reduction of inmate beds?
As you rightly mentioned, we recently entered into a contract with CCA to house these, and we have a contract with the state to do this. So there hasn't been any conversations that I'm aware of doing anything different at this point.
It might be helpful just for the TV audience to really try to maybe say that again, but breaking it down between the pretrial folks and the people who've been convicted of up to 6 years. Because I think what you're trying to say is that it's really 2 totally different buckets. For the people who've been convicted up to 6 years, they are felons. There's a contract with the state. Davidson County is housing them. And there would never be any cross-pollinating of those populations, right?
Well, we are.
Councilman, I believe you're right about that. Everyone that's arrested in Davidson County does come to our facility, and they may be charged with a particular crime. It may be a misdemeanor, it may be a felony. If in fact they're convicted of a felony and it's 1 to 6 years, at that point we would transfer them to state custody. That state custody happens to be a Metro Detention Facility here in Davidson County that is run by CCA. If they get convicted of a crime more than 6 years, we would send them to a different state facility. So, but you're right, everyone does get arrested, that gets arrested in Davidson County does come to our facility. It may be pretrial, it is pretrial, and they be misdemeanor charge or felony charge, but that is correct.
Well, right now, there's about 700 women that are in the CCA facility for this construction, right?
Yes, those are pretrial and misdemeanant.
But they're at
And how many, it's not 700 though.
No.
It's not 700, it's, tell me what.
Yeah, the female population that went over to CCA was about 350 females. So that number, although the facility you're speaking of, it had an overall capacity of 508. But to go back to the initial question about population reduction and the things that we're doing in Davidson County, especially in the sheriff's office, of course, we do what we call transition to jail to community, which is a nationally recognized program. We've been doing that for many years, and it's been funded for many years by the National Institute of Corrections. That's one thing that's been very successful for us. When you talk about the overall numbers of our population, when Chief Ford mentioned 1,000 beds, we literally had to open a facility out on Harding that was historically closed because our numbers had reduced so much. And when that population, when the new building moves, reopens and we move all that population back, we believe that other facility is going to shut down as well. So what you're seeing is a total, as of today, right around 600 beds that we have eliminated in this new construction based on all the population reduction, if that makes any sense. Better at Harding and downtown.
I'm the only one asking.
No, I'm waiting for you to take a deep breath. One, I want to thank everybody for all the hard work, so I want to be clear about that. But I just also want you to know that it's a 30-year commitment. I think we all understand that, so we want to be sure we get this right. And I really have some serious questions about this. So let me try to be a little more articulate. I was told at the last public meeting we had about a third of the population is mentally ill in the jail. Is that correct? Just roughly.
Right.
So, who is in this population? Are they the persistent mentally ill? Are they one-timers? What's the breakdown on this population? Can you help me out?
Okay, I'm sure I would have to send you some really stats about that, but yes, I have to do that. To go back to this facility here, the new facility, the 64 beds, When we first looked at those numbers in its totality based on the mentally ill that is incarcerated in the Davidson County system today, there was a population that historically what we believe was your low-level, mentally ill individual that has taken up a lot of taxpayers' money, going through the entire jail process, the courts and all of those kinds of things. When you look at this facility, the sheriff always talk about the young man who stopped all the traffic on the interstate. We realized that this individual was suffering from what we call anxiety. But when we processed that person through, we booked him, we clothed him, we took him to court, we transported him to the hospital, and that took up a lot of taxpayers' money. So this particular part of the institution will manage that group of individuals. The severely persistent mentally ill population will still, because we don't believe will meet that criteria to be in this low-level, unsecure facility. So that population will still go through the jail. What we have found based on the, the Criminal Justice Center, what we have found is that there are new national standards with the restrictive housing, and I'm sure you might be aware that one of the things they talk about is the severely persistent mentally ill shouldn't be in jail at all, period. So one of the things that we have started internally as a part of that process, which we are accredited by the American Correctional Association, we have to work very hard to reduce that number. So in our efforts, we have already started meeting with Correct Care Solution, which is our contracted medical staff. We've already started meeting with the Mental Health Co-op, who is also subcontracted by CCS, Correct Care Solution, to deal with our mentally ill, as well as our own internal mental health staff to start working on reducing that population. So what we believe within the next 14 months, we should see a tremendous decline of those type of individuals that are classified as severely persistent mentally ill and divert them maybe in another, what we've been trying to do, transitional type diversionary program. And it goes back to what Mr. Matthews talked about. Maybe we can reach out to the NOAA group, and I know we've had some conversation. How do we partner together to do the best that we can for the Nashville community?
Well, let me thank you for that, because you're exactly right. That's the way the national standards are, the way we are moving. I'm glad to hear we're moving in that direction.
Yes, sir.
Which gets back to my first point. If we're diverting all these people out of the jail, what the hell are we doing putting 300 beds in there for them? I mean, it doesn't make sense if we're having a major diversion program to have a huge allocation of mental health beds. That's kind of contradictory.
Understood. One taken.
And I think we just have to continue that conversation. I mean, we have to make sure that the community programs are sustainable, that they're going to be around before we could really give you a definite or a committed answer to that question. But definitely understand the question.
We're going to reach a point soon where we're going to be talking about pouring concrete and doing stuff like that. It's going to make the whole conversation moot. So we do need to get this stuff squared away soon.
Yeah. All right. Yes, Ms. Chambers?
Can you confirm that the offender reentry center is going to close after this construction is done, and that so is the Hill Center 2 gonna still have people in it after this construction's done, or will that building go away?
It's the Funder Reentry Center and Funder.
The ORC, right, we understand.
Okay, the ORC and the Hill Center too?
Yes.
Are they going to still be operating after construction? No.
No.
Well, let me clarify that.
Right.
No. Go
The
ahead.
Hill Detention Center, that will close because of the new detention center opening up. That combines the old CJC and HDC. The ORC, the plan would be to close it again, but we can't make any commitment until we get to that point where we really know we can do that.
Did that building ORC flood in 2010?
No, it did not.
It did. Okay, and then is Ezo Park going to remain open for the 6 soccer fields?
Yes, ma'am.
Okay. Excellent, thank you.
All right. Any other questions? Seeing none, thank you for sharing your evening with us. We will be presenting this on Metro Nashville Network, and thank you for coming out. Thank General Services, Bell Construction, our architects, Sheriff's Department, and our council members that joined us this evening, too. Thank you.